Up next, Schizophrenia and Me. Hollie is an individual living with schizophrenia and other mental illnesses. She is also a mother and a wife. She wants to educate others on mental illness to help end the stigma surrounding it. In her presentation, Schizophrenia and Me, she will share information on causes and symptoms of schizophrenia and treatment options. She'll also talk about living with schizophrenia. Please join me in welcoming Hollie to Real Voices, Real Choices.
My name is Hollie, and I'm going to share some information as to what schizophrenia is, symptoms, what you can do for someone with schizophrenia, and share a little bit about my story. Schizophrenia, what's that? Schizophrenia is a chronic and severe disorder that affects how a person thinks, feels, and acts. Positive symptoms. Positives doesn't mean good in this sense. Having positive symptoms means that a person loses touch with reality. Positive symptoms are not generally seen in healthy people. Hallucinations. These can occur in any of the five senses: see, hear, touch, taste, and smell. The most common are auditory hallucinations, in which you hear them. So you could hear voices or see people or shadows in which are not really there. Delusions. Delusions are thoughts that people, or like neighbors, governments, are out to get you, hurt, poison, follow them, and you believe that people on television are directing special messages to them and to them only. So they're false beliefs that are not consistent with the person's culture. Thought disorders. Unusual or dysfunctional ways of thinking. Disorganized thinking is when a person has a difficult time organizing their thoughts or putting things together in a way in which people can understand. Word salad. Word salad is talking in a confused manner that is hard to make sense of. Thought blocking. Thought blocking is when a person stops talking in the middle of a sentence as if the thought just disappeared when they were talking. Neologisms. This is making up a meaningless word. Words. Movement disorders. Movement disorders may appear as agitated or restless body movements. Catatonia. That is when a person does not move or respond to others. It is very rare today since treatment is available. Negative symptoms. Negative symptoms are associated with trouble with normal emotions and behaviors. These symptoms can be mistaken for depression or other conditions. Flat effect. Flat effect is little expressions of emotions, and it's not as much expression or of emotions. My husband's family always said I would look angry or just as if I didn't have any emotion or expression. They would always say that I just didn't look happy. They said that they'd always tell me, well, you don't look happy, you look mad, or you look out of it. Another negative symptom, you don't enjoy things that you once did. You may not enjoy your hobbies or spending time or talking with friends or loved ones. You have a hard time starting and keeping up with everyday activities, hygiene, and household duties. Hygiene is a big one, and I had a hard time with my hygiene and performing household duties and everything. It was just really tough whenever I was having these negative symptoms. Reduced speaking. You just don't talk very much. This was something people noticed about me. I would just they'd be talking and trying to have conversations with me and stuff, and I just didn't talk much. People with schizophrenia often need help or encouragement to complete such tasks as hygiene. Encouraging them to take a shower is helpful, but do not pester or call them lazy or rebellious. Seeming lazy and rebellious or that they can't help themselves are symptoms of schizophrenia. Cognitive symptoms. Cognitive is related to reasoning, thinking, and the mind. Cognitive ability functions are only detected when certain tests that deal with memory and attention are performed. You have trouble using information given to you to make decisions. You have poor executive functioning, focusing, or paying attention. A person with schizophrenia may have trouble using information right after learning it, and this is called working memory. So, who does schizophrenia affect? Schizophrenia can affect anyone regardless of sex, age, and ethnicity. It affects more men than women. Symptoms of schizophrenia start between the ages of 16 and 30. This age is a very critical age. It is hard to diagnose schizophrenia in teenagers because as a teenager, most people go through a change anyway. Change of friends, grades, sleep problems, and being irritable are common amongst teenagers. Factors that can help predict schizophrenia in teens include family history of schizophrenia and psychosis, as well as withdrawal and isolation, along with thoughts that are not normal. Schizophrenia is not common in children, but that does not mean it doesn't exist. Children may not open up about symptoms such as hallucinations or thoughts unless asked. It is important to pay attention to sudden changes in thought and their behavior. So, what's the cause? Genes. Studies have shown that if a person has an immediate family member with schizophrenia, they are more likely to develop schizophrenia than the general population. Environment. Exposure to viruses or malnutrition before birth or problems during birth. Chemical imbalances. Who does it affect? It can affect any person of any ethnic group. It is shown to affect more men than women. Symptoms start between the age of 16 and 30. It rarely occurs in children, but people are becoming aware of onset schizophrenia in children. Treatment. Medication and schizophrenia. Treatment. You can do talk therapy, cognitive behavioral therapy. You can go to groups, family education and support from family, and then antipsychotic medications in pill, liquid, or injection form. So most people take their antipsychotic medication orally in pill form daily. And then there's others that, like me, that I take medication pill form every day. And then I also get an injection monthly. And so some medication can give fairly quick relief of symptoms associated with schizophrenia. And then others may notice a change in symptoms after about 4 to 6 weeks of medication. But everyone is different when it comes to how the body responds to medication. And it may take a few different times of trying a medication before finding the right one for a person. It is important to stay on your medication and take it as prescribed. If you are having concerns with your medication, it is important that you contact your psychiatrist or your physician about it. So, questions about schizophrenia. Are people with schizophrenia violent? No. In most cases, people with schizophrenia are more likely to harm themselves than to harm other people. And that's where the stigma comes in. So what does substance use have to do with schizophrenia? Schizophrenia and substance use. Nicotine is the most commonly used substance by people with schizophrenia and those with mental illness in general. Marijuana is also frequently used by those with schizophrenia. The best treatment for those with schizophrenia who also have a substance use problem is to find treatment that can help with both. Are people with schizophrenia more likely to attempt suicide? Suicide and self-harm behaviors are very common for individuals with schizophrenia. People with schizophrenia are at risk of dying earlier because of the increased suicide risk. If someone you know is thinking about suicide or has attempted suicide, please seek out immediate medical help or call 911. Can a person with schizophrenia live a happy and productive life? Yes. As long a person with schizophrenia can live a happy and productive life, they can, once they find the right medication regimen or talk therapy or any types of therapy and have the right support, a person with schizophrenia can be productive and be happy. How can I help? Listen, lend an ear. It is very important that you listen to a person with schizophrenia and anyone with mental illness in general. Encouragement. Encourage them every day to just try to do things and just be involved and everything. Just support the person with schizophrenia because they do need it. If they have the right support, they can live a happy life. Show them respect. Don't call them lazy. Don't call them crazy. Just respect them as the person they are. Be kind to one another. Has a quote from Ellen DeGeneres. Just be kind. And just like this quote right here, be kind, for everyone you meet is fighting a hard battle. So, a bit about me. My name is Holly. I am 29 years old. I am married to my high school sweetheart, Michael. We have been married for 10 and a half years, and together we have one daughter, Sophia, who is 10 years old. And my husband, Michael, has seen me at my worst times. He has been my main support through this mental health journey with schizophrenia and other mental illnesses. I'm also a type 1 diabetic. Like I said, my husband has been my main support through all this, and I have had family support as well. I've been hospitalized numerous times. I have went through loads of med changes, and I have had a few suicide attempts, and I just try to live every day in a positive way. Like I said, I've gone through loads of med changes, and I'm currently pretty stable right now. I go to groups online, and I deal with hallucinations, which are I'm coping pretty well with them and everything. And I feel like I'm on the right medication combination. And I just use coping skills. I deal with anxiety as well. I just do utilize coping skills and positive self-talk. I listen to music. I like doing arts and crafts. I like spending time with my family. I like cooking and I do a lot of baking. Um, I like watching movies. I like coloring and drawing. Um, and just like I said, I really enjoy spending time with family. So, if you have any questions or anything, you can email me at hmmarcille, Marcille at hotmail.com. And like I said, that's hmmarcille at hotmail.com. And you can get a hold of me that way. Thank you.
Wow, Holly, thank you so much for sharing your journey with us, as well as taking the time to share some constructive advice for those who may be experiencing. There you are, Holly. Hi, good morning.
Hello.
So I was just saying thank you so much for sharing your journey and just being just so authentic in your experiences, and for the helpful advice that you've been able to give a lot of people today who may also be facing some of the same challenges on their journey. I don't know if you can see the chat, but wow, everybody's just saying this was so great. Thank you for sharing. It's wonderful. I do see one question in regard to when and how did you discuss your mental illness with your child?
Well, we went to one of my therapy appointments. My husband and daughter Sophia and we went to one of my therapy appointments, and we talked to my therapist about it, and we explained to her that mommy has what they call a mental illness, and it's basically when your brain, because she was probably about 7 or 8 years old when we told her, and she's 10 now, and mommy has what they call a mental illness, and it is when your brain doesn't work right and stuff. And she seemed to kind of understand that and stuff, and she knows that in the past, that whenever I've been hospitalized, that it was because that my brain was sad and stuff. So we tried to explain it to her in terms she'd understand.
That sounds like such a great way to explain to a child the situation of a mental illness like schizophrenia, or any mental illness for that matter. Yeah, we'd love to have your questions in the chat for Holly. We're just seeing right now, which is wonderful. So many just great accolades for sharing your story, Holly. It's really, really great. I will ask a question of you went to high school with your husband. You were high school sweethearts. And so how long had the two of you been together when he first began to understand some of the challenges that you were facing with your mental illness?
Well, I was first diagnosed, I'm 29 now. I think I was first diagnosed around 19 or 20 with schizophrenia. And it took him a while to understand. At first, he was a bit scared and kind of angry because there was nothing he could do that he understood, and he didn't understand it. And I didn't understand it as well, and it was just very scary and confusing for all of us. And but over time, we both began to learn about it more, and he became more understanding, and it took a lot of time. I mean, we're talking a few years.
Sure. There's another question that's up there for you. Have you ever been misdiagnosed? You mentioned that you were first diagnosed when you were in your late teens. So prior to that, was there any sort of misdiagnosis of what you were actually going through?
I don't really recall. They, of course, they said that I had depression, and they did tell me a few times that I had bipolar and stuff. But once my personal psychiatrist that I worked with got to know me better and stuff, he's the one who gave me the official diagnosis. Because in hospitals, they don't have you very long. So they just kind of put a diagnosis on you while you're in the hospital. But the psychiatrist that I worked with personally for a few years and stuff, they're the ones who gave me the official diagnosis that has stuck with me now for 10 years. So
Great. Another question just came in from Candace. What advice would you give someone that is struggling with similar symptoms but is afraid to share them with others?
I would say first, maybe talk to a mental health professional and get a diagnosis or something. And you need to how do I put this? Talk to a mental health professional and seek out help and advocate for yourself. And then maybe talk to them about how you could talk to maybe tell your family and stuff. It's really hard. I've told people before about my diagnosis, and depending on the person, I've had backlash, and judgment, and then other people that are understanding. So it just, honestly, it depends on how you think the person might react, if you think they'll be understanding or not. It's hard. It really is hard.
Right. You really kind of just need to find first those people that you trust, that you know are not going to kind of place that judgment on you for having the symptoms, and be able to share that and start down a road to figuring out how to manage, how to cope, as you have done so well each and every day. So let's see. Some other good comments. Thank you for your courage and transparency. You've shed a lot of light and knowledge about what it's like to live with schizophrenia. Yes, you certainly have. Thank you.
Thank you.
Okay, here's another question. How or what was the best approach a therapist gave you?
Honestly, when it came to a therapist, I kind of did a little bit of shopping, because I would go to a couple sessions, and talk with them. And if I didn't feel that the fit was right, I would try to go to a different one and test it out, honestly. And that's how I feel with all practitioners and physicians and stuff. You got to make sure you find the right one that you feel comfortable and feel will help you best on your mental health journey and stuff, because it's really tough.
There's another question about mental illness in your family. Someone shared that it wasn't difficult for them to share inside their family because so many of their family members have mental illness. So they already had a kind of an understanding of it. What was your experience like in that regard?
No, mental illness doesn't really run in my family or anything that I've talked about with my family. It just kind of happened. It for me it was difficult. It truly was. Like I said, whenever I first talked to my husband about it, it was hard for him to understand and grasp it, and it was even really hard for my parents as well to understand it as well, because they hated seeing me struggle with when there was really nothing that they could necessarily really do, because it wasn't like a physical thing. It's a mental thing, and they had a hard time grasping it, and then just the stigma with it and stuff.
And now I'm sure that your family has become some of your biggest supporters, and I'm sure it was a struggle for your family to see you hurting, but not being able to physically see what was happening inside of you. So share a little bit about your family now as your support system.
Do I?
Can you share a little bit about your family now as a support system, now that they kind of have a better understanding?
Yes, they're, like I said, they, along with my husband and even my daughter now and stuff, they're all very supportive. They can usually kind of tell when something is up, and they'll ask me if I'm doing okay. And they, even if I say I'm fine, they're like, we can tell something's up. You're not talking. You're just sitting there dazing off and stuff. So I can't really keep anything from them. So, but they're very supportive. If I need to talk about something or anything, I can usually go to my mom or my dad or even my husband and tell them, well, hey, I'm kind of having some breakthrough symptoms. I'm having some anxiety. I'm feeling a little bit down in the dumps, or hey, I don't really feel like I can be alone right now and stuff. And they all understand. So
Sure. They get it. Absolutely. Well, again, I hope you're able to see the comments in the chat. You truly are beautiful and courageous, and we just so admire all that you are doing to share your story with others, so that you can help lead them and guide them to help they may need themselves. So let's see, there might be one more question real quick. What was the most memorable or helpful thing that your mental health team was able to do to get you through a tough time?
Well, they just, my mental health team, they're always good. If I'm having a hard time, I can usually call them and they can get me into an appointment sooner, and offer support and just lend an ear and assess me if I make sure I'm safe, and just offer support, extra support, But it's always good that I can, if something's up, they always tell me, well, if you need to get in sooner, you need someone to talk, just give us a call. And I have done that in the past, and they've always been good. Well, hey, we can squeeze you in at this time, or all right, just come in and we'll get you in, and we'll talk to you and we'll assess you. So yeah.
Awesome. Well, again, Hollie, thank you so much for your courage and for presenting and making yourself available to answer questions. And just amazing. What a great job you did. I know a lot of people took some great notes and are going to take and hold on to those so that they can use those to help them through their own journey. So thank you so much, Hollie. We appreciate all that you have done today. And thanks for your work on the conference committee. We know that you're a part of that as well. So thanks for your work to bring all of us together this Monday and Tuesday of
Thank you. And thank you all for the kind comments.